In this video, I'm going to talk about mutations, cancer, and genetic testing. And specifically, I'm going to focus on a gene known as BRCA1, which is associated with the development of breast and ovarian cancer. Recall that DNA is in the nucleus of our cells and stores information that gets relayed to the cytoplasm via messenger RNA, and that messenger RNA is used to direct the synthesis of protein. So BRCA1 tends to get a bad rap because, as I said, it's associated with breast and ovarian cancer. But for most individuals, they have normal BRCA1 genes. They produce normal BRCA1 messenger RNA. And the protein that results is actually protective. It's a tumor suppressor, which, as the name implies, suppresses the formation of tumors. So BRCA1 is a protective gene. It's good for our cells. How does it help? Well, it repairs damaged DNA. So over time, DNA tends to accumulate changes or mutations. And BRCA1's job is to fix these mutations and restore our DNA. Some individuals inherit mutations in the BRCA1 gene. They will then have corresponding changes to the BRCA1 messenger RNA, which in turn will lead to the production of defective tumor suppressors. So without functional BRCA1, the problem is that mutations will accumulate. If a mutation arises, BRCA1 is unable to fix it, and over time, more mutations are going to occur. So these individuals that have BRCA1 mutations tend to accumulate many mutations over time. And we know that mutations are associated with the development of cancer. When we think of cancer, we often are thinking of, how do we cure cancer? How do we treat cancer? But another important question is, how do we prevent it? And our knowledge of the BRCA1 gene is one way that we can help to prevent breast cancer. So there are techniques that we can use to identify individuals who carry mutations in the BRCA1 gene. And if a woman carries that mutation, she can make different decisions about her care. For example, she might receive more preventative screening for breast cancer. The test is not for everyone, so it's indicated if a woman has a strong family history of breast or ovarian cancer. Angelina Jolie, she is an individual who had a family history of cancer. So her mother died at an early age from ovarian cancer. And Angelina wrote an opinion piece in the New York Times stating that she has a mutation in the BRCA1 gene, and because of that decided to get a prophylactic double mastectomy. So the knowledge of the BRCA1 gene is allowing women to make decisions about their care that can help to prevent cancer. So how does this genetic testing work? Usually there's a blood sample that's taken, and the white blood cells are used as a source of DNA. And then a technique that you've learned about called PCR is employed. So keep in mind that there are multiple different BRCA1 mutations that people can inherit. This is one example of a deletion in the BRCA1 gene and how a PCR test can be used to identify that deletion. So during PCR, primers are used and anneal to the template DNA. So in individuals that have the BRCA1 deletion, the primer is designed so that it sticks to the region of the DNA harboring that deletion. The same primer set, if used on individuals that don't carry the mutation, the first primer will anneal, while the second primer, there is no deletion. That primer doesn't stick to the DNA. And so what will happen is if an individual harbors this deletion, a PCR product will be produced in the first case where the primers both anneal. Without the deletion, no PCR product will be produced. Okay, so this would be the result. Again, if an individual has the BRCA1 deletion, they'll have PCR product. If an individual does not no PCR product will be produced. So this is a positive test, and this is a negative test. So if a woman gets a positive test and she carries a BRCA1 mutation, that gives her a 55 to 65% risk of developing breast cancer and a 39% risk of developing ovarian cancer, both by the age of 70. A negative test does not mean that a woman will not develop breast cancer. So only 5 to 10% of breast cancer cases are attributed to mutations in BRCA1 and an associated gene BRCA2. And many cases of breast cancer are simply sporadic. All right, so if you want to learn more about BRCA1 and genetic testing, I recommend that you go to the DNA Learning Center. I've listed the site below. They've got a great animation that goes over this genetic testing.